typically your doctor, your surgeon, your urologist, your medical oncologist is going to sit down with you and kind of give you the bad news that you've been diagnosed with cancer. And then one of the next things they may say to you is that, and I think radiation treatment's going to be an important part of taking care of this cancer. And very frequently then they will make a recommendation to you as to where you should go and have your treatment. And this is the way that we get most of our patients. They're referred to us by other physicians. But we want you to understand that it's an important decision that you're a part of making that decision. And there's a lot of factors that you need to consider when you make that decision.
Dr. Gregorich has a very fine reputation here in the Buffalo area. And when they come here, they've already been diagnosed. They know what they have. And they have what's called a consult, which is a meeting with Dr. Gregorich to review all the clinical data, all the x-rays, and everything that's required for treatment.
We recognize that cancer is a pretty complicated disease. It's something about which most patients, it's a totally new experience for them. Very often they don't even understand really on a cellular level what's going on when they have a diagnosis of cancer. So we want to be able to sit down with them and explain, okay, you have breast cancer, you have prostate cancer. This is really what's going on in your breast. This is how it developed. And this is why it is potentially life-threatening. This is how the cancer can spread. And here's where you are right now.
I would be the person to greet the patient when they first arrive at our facility, get them all signed in, registered, help them through the initial paperwork that's always involved when you're going to a doctor's office for the first time. I like to go over the insurance information with the patient. There's so many different insurances out now, so we'll go over that. Co-pays I'll discuss with the patient. Many insurances, there are co-pays, and there are co-pays for daily treatment for radiation. So we have various ways for the patient to pay that co-pay. So we'll go over that together and decide what's best for their budget and just try to ease their mind a little bit. For some patients, it's a problem for them to get back and forth for daily treatment. So we have different options for travel. So I can go over that with them and get them set up for transportation for their radiation treatment. There's different ways that we can help them, and we like to get that set up for them so it's one less thing for them to worry about. The main question is, how quickly will I be starting my treatment? I mean, they've got this cancer diagnosis and they're anxious to get started. So, I mean, they'd like to start that day if possible, but there is a process that has to happen. The main thing is most insurances now require authorizations to have radiation treatment performed. So we have to go through the various insurances and get those authorizations, and that takes a bit of time depending on the type of insurance. So I like to give them a time frame when they'll need to come back for their CTs and their plans to start the treatment.
When they first come in, we're going to do a history and physical, just like if they've gone to other doctors' offices, but we're going to do our own history and physical. We're going to find out, what medications they're on. We're going to find out, do they have any history of blood pressure problems? Do they have any other history of any type of ailments? We're going to ask them, have they had radiation treatments before? Do you know what to expect? Are they going through chemo at this time? So if they're going through chemo, we'll tell them what they can expect with this, and also help them through the process of radiation.
Simulation treatment really is just the starting point. You have to start from somewhere. So we're establishing a position that's reproducible, which is one of the key things in receiving an accurate radiation treatment. The importance of setting up a position that's reproducible every day, that a patient can be comfortable in, Not everybody can hold their arms up for an extended period of time. Not everybody can lay on their back for an extended period of time. So you have to find a compromise. You have to find a position that's doable for the doctor to come up with a good plan, and you have to find a position that the patient is comfortable in for an extended period of time also.
The treatments themselves, they're lying on our radiation treatment table for no more than about 8 to 10 minutes a day. And of that time, the radiation machine is probably turned on for no more than 5 or 6 minutes. During that time, it makes a humming or a buzzing sound, and that's all they'll be aware of. Otherwise, it's just like having an X-ray picture taken. When the treatment is done, they will hop down off our radiation treatment table, walk out of our department feeling exactly the same way they did when they walked in. The one exception that I always explain to that is if we're treating either a large area of the small bowel or the stomach. For the first 4 or 5 treatments, there's a small risk that they may have a little queasiness or nausea. For those patients, I'll always give them a little mild anti-nausea medicine for the first 3 or 4 days. It's generally only 5 to 10% of patients that have any nausea from those first radiation treatments. Once we get them through the first week, the body seems to become immune to the nausea-inducing effects of the radiation, and typically they don't need those pills any longer. But all other areas of the body, the patients walk out of here feeling just the same way they did when they walked in. I emphasize, if you drove yourself in for your treatment, you can drive yourself home. You can go right back to work if you like.
While you're receiving the treatment, you're not going to feel anything, which is wonderful. Okay, so it's a beam of light, and it goes right to whatever particular area that you're being treated. And while you're receiving the treatment, there's nothing that you feel. They can, if you'd like, they can play some music in the background for you to, help you try to relax and stuff like that. But the treatment itself is fairly quick. Then you're out again. And what's nice is that they can pick times that is good for them. So whether it be in the morning or the afternoon, we'll go around their schedule so that it's more convenient for them. Whatever we can do to help maintain their normal lifestyle and everything going on, we want to do that for them.
That always amazes me to see the transformation with patients, to see them from being really afraid and then trusting the process and realizing that we're there to help them and that they're in good hands.